is a prospective comparison of wavefront guided LASIK and wavefront optimized LASIK. We're looking forward to that in the documentary. Thank you.
Thank you. These are my financial disclosures that have no direct conflict with the information in this presentation. This is a prospective randomized study. When I was randomized to have wavefront guided LASIK, and the fellow I was randomized to have wavefront optimized LASIK. There were 90 eyes and 45 subjects. The wavefront guided LASIK was performed using the Physics AMO platform, and the wavefront optimized LASIK was performed using the Alcon Allegretto 400 Hz. All the LASIK flaps were created with a intralay 60 kilohertz laser using a 105 micron flap with a 9.2 millimeter superior hinge. They were closely matched preoperatively with about 4.5 diopters of spherical equivalent in each group and just under a diopter of cylinder. Both lower and higher order aberrations were no statistically significant differences preoperatively, as can be seen here. Looking at 1 month, we see that we've reduced the myopia to about a quarter diopter in both groups. We've had increases in total higher order RMS values as well as coma in both groups. Going to 3 months, we see that the spherical equivalent is identical in each group, and we have increases in total higher order optimized. This difference was statistically significant. Also, we had lower residual cylinder in the wavefront guided 0.16 compared to 0.23, and this also reached statistical significance. So in both, we had an increase in magnitude in the degree of aberrations as in coma in both groups. So looking at the predictability, this just shows excellent outcomes in each group. The wavefront guided in red and the wavefront optimized in blue. Looking at uncorrected visual acuity, what we found was both groups did quite well on day 1. 100% 2063 or better on day 1. But one of the things to note is if you look at 2020 or better, in the wavefront optimized in yellow versus the wavefront guided in yellow versus wavefront optimized in blue, we see we had 90% of eyes 2020 or better at 1 week in wavefront guided versus 78% in the wavefront optimized. And if you look at even 2016 and 2012.5, there's a clear advantage in the wavefront guided. Again, looking 1 month and at 3 months. So in conclusion, we had excellent safety in both groups. We had better predictability in the wavefront guided group compared to wavefront optimized. There was an induction in higher order aberrations in both groups, but the magnitude of the induction in the wavefront optimized was significantly higher. We had low residual cylinder in the wavefront guided compared to the wavefront optimized group. No difference in 5 and 25% contrast acuities, but we had significantly better uncorrected visual acuity in the wavefront guided group at all time intervals compared to the wavefront optimized. These were done with PRK, which is obviously considered off-label in the U.S. We had mechanical removal of the epithelium using a Moyle's brush, and we did not use mitomycin C in these cases. The mean spherical equivalent was about 4.75 in each group with about 3/4 of diopter of cylinder, and the both lower and second and higher order aberrations were closely matched. There's no statistically significant difference. Looking at the outcomes in the early period of 1 month, we see about a quarter diopter of residual cylinder in each group, about a half diopter quarter diopter mean spherical equivalent. Higher order aberrations were increased in both groups on all measures. There's no differences between the two groups. And going out to 3 months, you can see we reduced the mean spherical equivalent close to 0 in each group, with no difference in mean spherical equivalent and no difference in residual cylinder between the two groups. We did not have any significant corneal haze in either group. We had an induction of higher order aberrations in both groups, but the magnitude was the same in each group. No difference in contrast acuity, and similar efficacy in both groups at 3 months. But there was a significantly better visual recovery in the early postoperative period when using the wavefront optimized group compared to the wavefront guided. We think some of the data may become a little clearer when we look at the 6 and 12% within 1 diopter of the intended still, if you look at 20/20 or better, in the Wavefront optimized, you have 40% versus 20% in the Wavefront guide. When you get out to 1 month, the results are starting to get better, but you still have a slight edge to the Wavefront optimized group. And then by 3 months, there was no statistically significant difference between the two groups. Looking at